My name is Monica Ponder. I'm a registered nurse and a clinical nursing supervisor at American Home Health. The subjects we're going to cover today are gastrostomy tubes and enteral feedings. There are three main types of gastrostomy tubes that any of our home health nurses will find in the clinical area. They are the G button or the Mickey button, the PEG or gastrostomy tube, and the GJ or gastrostomy jejunostomy tube. Each of them have their own separate and distinct characteristics, but what they have in common is that they are all tubes that are placed in the stomach to facilitate feeding. When working with a gastrostomy tube, there are certain universal principles that need to be observed. The first one is informing your client of the procedure. While it is necessary to inform parents in the home of the procedure, your clients may range from infants to centenarians, octogenarians, geriatric personnel. Children especially love to be touched, they love to be talked to, they love to be both physically and verbally comforted. When you're working with a child, as when you're working with the elderly, be sure to talk to your child. They may not understand what you're saying, but they will certainly understand the intent, and they will certainly benefit from the comfort and the confidence and the trust that you give them. The second thing to bear in mind and to practice can't be stressed anywhere near enough, and that is hand hygiene. Washing your hands before and after every procedure, washing your hands before and after gloving is of paramount importance. Washing your hands anytime there is a potential for coming in contact with protein-based fluids, which is any fluid that comes out of a person's body, is absolutely necessary both for your protection and for the protection of your client. The third thing to bear in mind is that you need to assemble all of your equipment in advance. If it's a sterile field, the non-sterile components of the field need to be set up first. The sterile field needs to be put together. If it's a clean procedure, all your equipment needs to be at hand. There is nothing I can think of that is more embarrassing and dangerous than being in the middle of a procedure and reaching for a piece of equipment that is not there. You have, at that point, a danger of infection, a danger of contamination, and the possibility of physical danger both to yourself and your client. We will now talk about gastrostomy tubes, and we will begin demonstrating the care of the gastrostomy tube site and the tube itself. For the purposes of this video, we will be using a Mickey button, which is a two-piece locking gastrostomy